Hello, welcome to the Long Beach Post live chat at 1 o'clock. My name is Melissa Evans. I'm the managing editor here at the Long Beach Post. And today, co hosting with me is reporter Kelly Puente. We're happy to have Mayor Robert Garcia joining us again this afternoon to talk about the coronavirus, the COVID-19, some of the budget stuff going on with the city as a result of the pandemic. So there's a lot of, we were just chatting earlier, there's a lot to talk about. I will be also monitoring questions that the audience that you might have. So please put your questions in the comments feed on Facebook or YouTube, and we'll get started right away. So first, we were just right before we went live, we were talking about some of the numbers that have been reported over the past few weeks. I just want to get a sense, just overall, how nervous are you right now, and health officials about kind of this. I don't know if it's a second wave, but this new rise in cases and hospitalizations in particular that we're seeing.
I mean, honestly, I've been nervous for months since this whole thing started. So I think that we should all have and all feel a sense um, uh, of commitment to tackling this problem. This is not a problem that's gone. The virus is real. There is still no official vaccine, and we see what's going on across the country here in California and here locally with the positivity rate. So yeah, I'm nervous. I'm concerned, but we're also determined to do the right thing, to keep people safe, and I think that we've learned an enormous amount in the last few months about COVID-19, and so we're putting that into practice, and we are implementing uh, those strategies out in the field and in our hospitals, and so yeah, we are concerned, but we're also we're very focused on doing the right thing.
And
How,
I'm sorry.
just to follow up real quick, how has the city's understanding of the virus changed over the past couple months? You mentioned you've learned some stuff.
Yeah, I mean, I think what are the lessons learned? I think initially, I think the first thing that we realized really quick is this started off as a huge issue in our long-term care facilities. I mean, Kelly, you've done a lot of reporting on that, and we learned really quickly how quickly it spread to people that are the most vulnerable in our city. And so, I mean, just going into these facilities, working with all of them, organizing them, making sure that people were being tested. That happened very quick. That was something we learned. We learned really quick that we couldn't depend on the federal government. And I think that we were told really early on that we were going to get all these tests, and that we were going to set all this money for testing and these kits, and none of that ever really happened. And so we had to quickly shift course and do it ourselves. And we had to personally, having to call companies in South Korea and other places across the world to get the tests ourselves, to get contracts in ourselves. We learned that very quickly. And we also, another lesson is really this idea that you got to fend for yourself. And yes, we're part of a larger network, but Long Beach, we got to take care of ourselves, our hospital system. We got to prepare. No one is coming to save us. We've got to do this on our own. And so we've learned a lot of those lessons. And I'm really proud of the operation we have in the city. There's a lot of people working. I mean, we're working around the clock. I don't think folks have had a day off since this crisis really, I think, exploded in a few months ago in March. So those are some of the lessons learned, but we're learning more every day.
And speaking of the fending for ourselves and the issue of testing, I think one of the scariest things right now, and one of the biggest questions we're getting from residents is, you can't get a test anywhere in Long Beach right now. I even went today to try to book, and there was only 3 sites where you could maybe book, and they were all booked out. So, and I have a close friend who was trying to get tested this week, and that person can't get tested anywhere. They were even looking in Orange County. So what's going on with the testing situation right now?
Yeah, I don't know that I completely agree with the assessment, because you can get a test the day of, but here's the issue. I think we also need to communicate the process better. So let me take one step back. So first is we were doing about 1,000 tests a day for the last couple of weeks. And in fact, a couple of weeks ago, we had a lot of folks still not taking advantage of the testing. So we had more tests than slots. Then, a week or 2 weeks ago, we had really an explosion of interest on testing. This happened Long Beach. It happened across the state. You're reading stories everywhere about what's going on the testing issue. So we bumped that up. We're doing, like right now, we're doing 1,400 tests a day. And as a reminder, each test costs the city about $120 that we're of course doing for free, and procuring. And we're getting some support, of course, from CARES Act money and other places, but there is a cost. And ours is, whether you have insurance or not, we're giving people a test. So now we're doing about 1,400 tests a day. And the amount of tests that of interest that have happened in the last week or two have been enormous. What I would recommend to people is you're right, Kelly. I think if you go online and try to get a test, our testing right now for this week for appointments are pretty much full every single day, 1,400 a day at all of our testing sites. However, you can still get tested the day of. And what I want to remind people of is if you right now are symptomatic or you feel like you need to get a test, there is walk-up testing day of available. You can walk up to, today, we recommend most people go to the PCC campus at Long Beach City College. There is a wait, but you just park your car and walk up to the clinic that we have on campus or the testing site, and people are getting tested day of. So while the appointment drive-through system is absolutely full for the next few days, no question about that, the walk-up system, where you can walk up to a testing site, is open and are taking people every single day. The most capacity is at Long Beach City College, but I know people today that are other days that are walking up to Cabrillo High School and have I'm sorry, there's very little wait on the walk-ups, but I would go to Long Beach City College. But you're right, testing is full, and there's a lot more we can talk about on testing and why, but if you're symptomatic, please go to Long Beach City College PCC.
Any idea what the wait now is for the walk-ups?
It varies. And so we had people that went to Cabrillo, there was no wait for the walk-ups at Cabrillo High School. I mean, literally people walked up right to the walk-up, waited 20 minutes, got tested. Long Beach City College, I heard yesterday there was a hour wait to get the test, but they could just go and walk up and get the test there. So this is of course happening all over the place. So if you need to get a test, you can get it day of, but it will need to be a walk-up. It won't be a drive-through appointment. Moving forward, we have to get more testing capacity in place. And so that's something that we're currently working on. We're going to be expanding and doing even more testing here in the weeks ahead. What we're concerned about is, can we really grow quick enough to meet the need? Because there's a lot of folks that are asymptomatic are now just getting tested. And that's a good thing. We want folks to get tested. But what's happening is businesses that are opening up, for example, are sending all their employees to go get tested. And there's other ways to get tested. CVSs have a testing program in place with a partnership with the city that you can go get tested at certain CVSs for free. There are obviously private labs that do testing. Long Beach, since we started, has done almost 90,000 tests.
Wow.
So that's how many tests, 90,000 tests. A vast majority of those have been at our public testing sites. Some of those have been in some private labs and so forth. But that's a lot of tests. And we had to create this whole system quick. And I'm giving you a long answer, but we're also in the city, we exceed the state's kind of testing platform. So the state sets targets for every city in every jurisdiction in the state to meet, and we exceed those. I mean, right now we double the state's expectation. The state wants us to do about 750 tests a day to meet our need in Long Beach. Right now we're doing 1,400. So even by doubling kind of the state's mandate, we're seeing a massive amount of testing needs still out in the community, which means not only does the city have to do more, the state's got to come in and do more testing sites. And the federal government has got to literally wake up and realize this is a national emergency and provide national testing support, which they are not yet doing.
Real quick question from one of our viewers about testing. Can you get tested in the city if you don't live here or own a business here?
So the answer to that is right now is yes. So we're not turning people away. This is a health crisis that is a cross-border health crisis. And the same is for the county. So we are getting people, by the way, from our neighboring cities coming in. And there's there's a, I talked to some folks who are like, we shouldn't let anybody get tested from Orange County or from somewhere else. And I understand that. This is also a public health emergency. And we've tried to be like, Signal Hill is not from Long Beach, but they need testing support. They're our neighbor. Like I want them to get tested.
I live in Signal Hill and I got tested in Long Beach. So
Right. Yeah, exactly. We have friends in Lakewood. Lakewood's part of our community. Are we going to close our doors to our Lakewood neighbors and say, don't get tested? So that's a tough answer. Right now, we've been open to testing people from outside the city because unfortunately, if you're in LaSalle or in Seal Beach or one of our neighbors, good luck getting a test in Orange County in some cases. There's not a lot of testing capacity as well. So yes, anyone can get a test. We're thinking about maybe creating some testing sites that are Long Beach only. We might transition to that actually in a week or so, where we have a couple sites that anyone can get tested, and then some that are Long Beach residents only. So that's something we're considering to help kind of ease the burden.
Okay. And another question we had, a concern is how COVID is disproportionately impacting the Black community. Black residents are more likely to be hospitalized and die from COVID. So what is the city doing right now as far as education awareness? I think you mentioned earlier about possible drive-through mobile clinics
Yes.
in Black neighborhoods. So can you talk a little bit more about what we're doing to address this disparity?
Right. And so we know that the Black mortality rate on COVID is almost twice the population. This is that is a crisis in of itself. I've talked to a lot of members of the Black community on this issue. It's a concern that community members have raised, and Black Lives Matter, and so many others. We do have mobile units that are going into communities to do testing. That has continued. We also have launched, and I announced a week or two ago, a Black Health Equity initiative that's going to help put resources into this issue, because there needs to be direct support for the Black community to deal with this mortality issue that and all the health indicators that go along with it. Our hospitals and our health department are working on this as well. We're trying to get more testing out. If you look at where our testing centers are located, I think we've done a pretty good job of ensuring that we have testing centers located in underserved communities. There are 2 sites in the northern part of the city, in Jordan and Jordan Plus. We've got obviously a site right in the middle of central Long Beach at LAC. We have one in West Long Beach and Cabrillo. So I think we've done a good job of covering being in community centers, but we've got to do a lot more. And so that's a real concern for us, and it's something that we're watching as well.
we have a question here about the stay-at-home order, and I think can you just explain the stay-at-home order? It was actually never lifted. If I don't know if I'm correct in that, but can you just explain where we are in the stay-at-home? The question is, will the city be considering a stay-at-home order again? But I think it's still in place, right?
Right. I think maybe they're referring to kind of the stricter kind of like kind of shutdown that happened maybe a month or so ago. Where the city is and really where the state is. So if you think about what happened a few months ago, where we had essentially a shutdown of most businesses that were not considered essential by the state. And I think that happened obviously weeks ago. And then since that time, there has been a lifting of certain restrictions that have happened over time. We don't know what is next. It's really dependent on the public. And it's dependent on how safe we all stay. We do know is that there is no expectation that there are going to be any restrictions lifted anytime soon. If anything, things could get more strict if numbers don't improve over the course of the next couple of weeks. And I think that's really what's next. The stay-at-home order essentially is indefinite. And it's really been the real model is really the safer at home model, where we know that people are safer when they stay home, but we also know that folks are going to go out and get takeout or try to participate in safe activities. We just want folks to stay as safe as possible. That's why wearing face coverings, masks are so important when you're out, especially in a business or interacting with others. But the stay-at-home order continues, and we don't really know what's coming up next. It's all dependent on what the data comes back in the next few weeks.
You want to talk about the budget?
Sure.
Well, we're going to be hit huge. The economic impact. I've been trying to get the numbers just on how much we've spent on testing in the last couple months. I've been working with the city manager to try to get that. But yeah, how much has this cost us so far? And moving forward, I mean, it seems a little scary.
I mean, we have spent, and we'll spend, I mean, we're spending tens of millions of dollars. I mean, we don't have the exact number in front of us, but it is money that, we weren't expecting, obviously, to spend in this way. And certainly you always have reserves, which we still have, and they're still healthy. But we've had to reprioritize, we've had to readdress, and that's what we're doing. And I think there's, public health has got to be invested in. We are spending an enormous amount on testing, obviously. There is some reimbursement, obviously, that's coming down from the state through the Federal CARES Act money, which we're very grateful for, but there will be an impact on the budget this year. We've talked about that. There will be an impact in the budget in the years ahead, not just from the direct COVID impact of the cost of dealing with the crisis, but of the cost of the economic impacts. And so unemployment, businesses being shut down, sales tax and revenue not being generated through the economy, people's livelihoods, people having less to spend back into the economy. So all of that will have real impacts on the city. And it's going to be difficult. And this budget session and the budget that we'll be presenting at the end of this month or at the beginning of August will be impacted dramatically by COVID.
Do you anticipate the city will have to do layoffs, or is there any more specific sense of what the budget impacts might be?
I think first we have a kind of everything's on the table approach. And so we're not ruling anything out. We are, of course, talking to our employee groups and those that represent our employees about solutions as to how we kind of get through this together. But we are, everyone is working. I mean, we've redirected. I can't tell you how many folks in our city are now working and just at our testing sites. I mean, we have lifeguards and health officers and librarians and all sorts of folks doing different things right now that are really necessary to get us through this health crisis. We've had to reconstruct the way we communicate with the public and how we treat our youth programs and our after school programs. So people are working. We want to avoid obviously layoffs, but we're trying to work with our employee groups to come up with a solution that kind of works for everybody.
What more do you think the city could be doing at this point in its response to COVID? Is there anything that you'd like to see us doing in the future?
Yeah, I mean, first I want to say I just got this data in the last week, and this is, I think, a good thing, is the city and the health department did over 600 business visits. 600 visited 600 businesses across the city to look at compliance on whether they were following the stay-at-home, the health orders, right, as it relates to businesses. Over 90% of those businesses were in compliance with those orders, and so the health department.
That's in the county where they said like 80% were in non-compliance. So Long Beach is doing better than LA County.
Our health department, and we can get you guys, and Kelly Colopy has kind of all the details of that. She just gave me those numbers before we came on. But I've noticed that too. Most businesses in Long Beach are doing a really good job of complying. I have found that to be the case. I kind of scope things out when I go places, and those that have not complied, they'll quickly go into compliance. We haven't had a lot of fights with businesses or issues with businesses. So the businesses, I think, are doing a pretty good job. I think where we're still having some challenges is folks taking it seriously as it relates to face coverings and masks. I think there's still a lot of people, and unfortunately, there is nothing that I can say, that the media can report on, that health officials can encourage, that will change a certain segment of our neighbors' minds. So for some folks out there that live in our community, they just will not, regardless of what is said, listen to the science or the medical facts. and I'm not sure where they're consuming their information, but it's certainly not on the Long Beach Post or some of the other kind of news organizations that are kind of telling the facts out there. And so we have people and I've talked to some of them. In fact, I get every day I get messages from people saying, how dare you ask us to wear a mask when I walk into the grocery store, or this is a dictatorship. I have the freedom to do whatever I want. I'm not going to wear a mask, or if I want to go get COVID, I'll get it. This is daily from people in our city. And so for those folks, we're not going to get to. And so I wish they would comply and remember that following the rules in this moment is yes, it's a sacrifice, but it's the right and brave thing to do, because people are dying every single day. People that call me that are concerned, for example, every year about shootings, or they're concerned about homicides. If you're concerned about homicides in Long Beach, COVID-19 is the biggest killer that has existed in our city. Has way gone beyond the amount of homicides we will ever see in a given year in the city of Long Beach. Even in our in our most dangerous year in the history of the city of Long Beach, decades ago, where we had 125 homicides. I mean, COVID-19 in months is going to kill more people. And so that's how serious we have to take this.
This is a good question. It's one I think we've asked about in the past. Will the city start notifying the public of places that have had confirmed COVID-19 cases, like LA County does? So I assume that includes businesses too.
I think
that's a question, because people and employees don't know whether or not the business has. Some businesses are notifying their employees, weeks later, and that's been a big concern, I know, for breeders.
Yeah, and I think even the way LA County does it, it's kind of like a mixed bag. It's not like there's not one standard. Mm-hmm. I err, and I've told this here to our health officials, that I err on the side that we should be releasing way more information. There are a lot of our health folks have a lot of kind of concerns around kind of privacy rights and what is shared and when it's shared. They believe they are following the kind of California standard and kind of CDC standard that's being asked of them. But the city is beginning to share more. I want to say there should be something, I think, on the report that comes out today, if it hasn't come out already, about an incident that happened at one of the after school sites, the childcare sites. And so there needs to be more sharing that happens. We'll continue to push on that, and I think I'll follow up as well. So I'm not sure what the latest is, but they are alerting the folks that obviously within that space or within that business, but I don't know beyond that. More needs to happen.
That would be great to be able to get more info on
that. See if we can get to another quick question here. I know we're approaching 1:30. This has to do with, will the city release stats on individual hospitals that Long Beach residents can decide, so that Long Beach residents can decide which hospital to go to? Like, in other words, if St. Mary is full, can we know that? Or
so hospitals have to do that. We don't control the hospital systems. Obviously, they have to self-report the information, and they do report it to the state. We get a number that is kind of like the total occupancy number. We don't get real-time information. The city doesn't, about where a hospital is at. There's usually a lag. We get general ideas, but we don't have real-time information about where a hospital is at. We have some general information right now. Our hospitals still are about 60% occupancy as of yesterday, which has been, we were in the higher 50s. We might be a little bit over 60% still. What we're seeing, interestingly enough, also is we're seeing a lot more transfers from other places. So Orange County might transfer folks to our hospitals, but we don't have hospital data in real time. But again, I've talked to the heads of our hospitals. I talked to them a lot, and they're concerned, and they're starting to hear more concern in their voice about COVID, and it's still very serious.
And just real quick too on hospitalizations, seem like those numbers, I'm not sure how many viewers out there are checking the dashboard like we are every day, but the hospitalization numbers fluctuate quite widely from day to day. Can you just elaborate? I think we've asked about this before, but how is it that those, because that's supposed to be kind of an important, reliable metric, is how many people are in the hospital.
Right, and I think that's why the health department has said it's always, that number is more reliable, like
Right.
a few days later or a week later,
Oh,
because and we try to update it, because what happens is it's all in the reporting. The hospitals actually have to do the inputting of the reporting, and there's so many. Their focus is on patient care, and so them inputting the hospital data and making sure that people are inputted in the right category. Sometimes it'll happen the next day. Sometimes it'll happen a couple of days later. Is why it's not as consistent as we would like. But we know that after a few days, that will change. And we also get, sometimes they'll update it, so they'll realize, oh no, this hospitalization actually occurred on this date, so we'll get an update, or this person left the hospital on this date. So the data becomes much more reliable a few days after, because it's updated by the hospitals, but we don't control that data. So we're essentially just the consumers of the data, and then that data goes onto the dashboard.
all right.
And as far as just Long Beach scaling back on some of our reopening plans with bars being closed again, what are the next like 3 weeks going to look like for us, and how are we monitoring those numbers, and when can we see possibly moving forward again?
So, if you look back at the closing, and I think I mentioned this, and I don't know if a lot of folks in Long Beach know, I mean, Long Beach had the slowest reopening schedule, I think, of any city in Southern California. And we waited in that additional week for a lot of the personal grooming, the nail salons, and the esthetician work behind the county. And we did that because we were still very concerned and cautious about the reopenings. Now that we are seeing the governor scale back the bar issue and the indoor restaurant issue, we're prepared to do whatever it takes to keep people safe. And so as far as what's next, I don't think anyone in Long Beach should expect anything to reopen that's not open right now anytime soon. The governor said that he was going to wait 21 days for the state to evaluate the closures of bars and the indoor dining at the restaurants. So I think 21 days, I think maybe by the end of next week or the week after is when we'll kind of have an idea of what's next. But it'll all be dependent on that data. And remember, when we talk about what we've learned, we've also learned where the virus spreads the quickest. And so a lot of the closures that are happening now are based on where we think the spread is happening faster, or where the state thinks the spread is happening faster. And the CDC and others have kind of categorized bars in particular as a place where they are seeing a high spread. And as you know, it's hard. I mean, many of our bars are cultural establishments. I mean, these are places that people go to. It's not just about having a beer at the bar. It's about places where people meet up. For some communities, like the LGBTQ community, they're safe spaces for people to gather. And so it's really sad to see. We just want to continue to keep people safe and reopen safely.
We're a few minutes past 1:30, so we will wrap it up. We did get a lot of questions that we unfortunately didn't get to. Hopefully we can have you back again
Sure.
soon. It seems like this pandemic's going to be with us for at least the rest of this year. So thank you, Kelly, for co-hosting with me, and thank you, Mayor, for joining us.
Sure.
We
Can
will.
I say one last thing before we head out?
Mhm.
Thank you. I just wanted to say, because I know folks are watching, and will also later on the just please remember that, and it's hard because right now I think a lot of people feel like they're in despair, which I do too. We all wake up with the weight of what's going on. And I just think we all just got to remember in this really like dark time that we're learning a lot. Your city is on it, and this is going to get better. Like, we are going to come out of this, and things are going to get better. and we're going to learn so much about how to handle things like this as a country the next time around as well. So we're going to get there. I'm confident that we are.
It has been a rough year, 2020 so far, but
2020 has been the absolute worst.
yeah.
Total nightmare. Yeah.
Oh, man.
Well, we will. It's only half over.
The sooner the better. I like that. I love that meme that you're seeing around where it says, obviously we never invented time travel in the future, or it's obviously someone would have come back and like fixed all the problems this year. So yeah.
Right. Well, we hope to have you back, and maybe next time we'll have some better news about our progress and positivity and hospitalizations. So thank you again for joining us. We really appreciate it.
Good thing.
And we will get this video posted on our website as well, and we'll try to get the questions we didn't get to. We'll try to get those answered as well. So thank you for joining us, and we'll talk again soon. All right.